I'd like to welcome you to this short video where we'll be talking about neck and shoulder pain. Our goal is to provide you with an overview of the specific treatment methods we use to identify and treat the cause of the problem, not just the symptoms. In approaching shoulder and neck pain treatment in this fashion, we help you maintain activity and integrate that activity into your normal lifestyle. So with that brief introduction, let's take a look at the condition that we refer to as impingement syndrome. Now what you're looking at here is an illustration of the anatomy of the rotator cuff on the left. The rotator cuff are four muscles that run from the shoulder blade to the upper part of the arm and form a cuff around the upper part of the arm. They're in a very important group of muscles. In fact, in the rehab world, we say that the key to rehabbing a shoulder condition is the rehabilitation of the rotator cuff itself. Now, the rotator cuff is made up of four muscles that, like I said, surround the upper part of the arm. And those muscles are, on the left here, the subscapularis, and just below that you'll see another muscle, that's the teres minor. And then on the right, you'll see the infraspinatus, which is the muscle right below the spine of the scapula here. And then sitting on top, the supraspinatus. Now, of the four rotator cuff muscles, the supraspinatus is the one that becomes or can become impinged. If you take a look at the illustration on the right, you'll see that there's that bursa, which is that sac of fluid that helps with friction or reducing friction. And it sits right below the acromioclavicular joint and the ligament that runs just above it. And that is the area that both the bursa and the supraspinatus can become impinged and create conditions that we refer to as bursitis or tendinitis. There are specific activities that we utilize to treat both of those types of conditions, with the goal of being to decrease the inflammation first and then to rehabilitate any weakness that is there. Sometimes there are conditions that we can't control conservatively, and that's where you may need specific injection therapy into that area to reduce the inflammation, or in cases where the bony anatomy is really impinging on the structures, the bursa or the tendon, then you may need some type of decompression type of surgery. So in the next video, what we'll do is we'll show you what we do to rehabilitate rotator cuff tears, and there are two types of tears that we see, ones that are partial thickness and the other ones are full thickness. On behalf of the entire Back Pain Relief Secrets team, I'd like to thank you for your interest in learning how to better care for your neck and shoulder. In an effort to better understand your specific needs, we'd also like to provide you with a free telephone consultation with one of our healthcare professionals. To arrange your private consultation, simply click the link you see below this video. All good health to you, and we do hope our paths cross soon.